A new report from the American Academy of Pediatrics has some warnings for parents about potential problems related to social media sites.
The report says doctors and parents need to be on the lookout for signs of Facebook depression, cyberbullying, and risky behaviors like sexting. OMG, what's going on? Dr. Zorba Paster joining us from his office in Oregon to talk more about this. How big of a concern is this, Zorba?
Oh, I think it's a very significant concern. I think one of the problems that we see is that with social media, it's very hard to actually look at your kids and determine what is actually going on. It used to be easy. You would either see their friends around or you would see them on the phone, you know, talking on the phone to their friends. But this has been going on for a long time. I mean, it certainly went on in websites before there was social media, and I think it's sort of parents becoming aware of this.
What are some of the specifics of things like Facebook depression? What are they talking about, and what should parents be looking for?
Well, I think, first of all, one very important way to really monitor what your kids are doing is to take the computer out of the bedroom and put the computer in the living room. It's a wonderful, low-tech way to really know what your kids are doing. If it's in the living room or if it's in the kitchen, they're just more likely to sort of pay attention and show you what's going on. The problem with things such as Facebook is that you don't necessarily want to go in and snoop on your kids. On the other hand, you want to monitor your kids. And so I think this is really a talking point, a chance for you, especially with a young teenager, to really talk to them and say, what are you talking about, who are you texting with, and so on. The sexting, which is showing provocative pictures in the mail or by text messages, has really become a major issue in some states.
And that's pretty hard to regulate because the kid's walking around with a cell phone.
It's very hard to regulate. But the thing about teenagers is they always test the limits. They're always looking at what are the boundaries of what they can do. And so I think talking with them as a parent is really sort of one of the most important things you can do. The other thing that the study showed is that teenagers who are depressed and upset and are anxious will often talk about that with their friends on Facebook. And they may not talk about it to their parents. And it's really a matter of saying, who are these friends of yours? Who do you know? And as a parent, sort of beginning to take some control over that.
So that's one of the positive things that can come out of it.
Absolutely. If you look at the data, it shows that 5, maybe even 10% of all the teenagers may actually have depression, and being able to actually get a handle on that is important, because if you help a teen with depression, you're helping them during a very important part of their lives, and you may be preventing something serious, such as a suicidal attempt, which often is something that comes from very serious depression.
All right, just keep an eye on things, I guess. Dr. Zorba Paster?
Absolutely. It's our job as parents to always do that.
Okay, we'll see you next time. Thank you.
Thanks, Zorba.